long. So thank you everybody for joining us tonight for the virtual information session on the Masters of Science in Athletic Training here at Lock Haven. Really excited for this. The event should take probably 35 minutes. Dr. Lippincott, I'm sure we'll be taking questions all throughout the course of the presentation. And again, if there's anything that you want to know more about, please do not hesitate to let us know. We can make this pretty informal. My name is Tom Kresh. I'm the Director of Enrollment Communications and Graduate Admissions. Most of you probably got an email from me today, reminding everyone and saying, hey, can't wait to see you tonight. So thank you for joining us. But before we go any further, I'm going to go ahead and allow Dr. Lippincott to introduce himself. Go ahead, Eric.
Yeah, thanks, Tom. It's good to see all of you. I'm real excited to be here tonight, and I'm happy that you're joining us. My name is Eric Lippincott. I'm a faculty member in the Department of Health and Exercise Science at the Lock Haven campus, and also serve as the director of the graduate program in athletic training. A little bit about myself. I have an undergraduate degree in athletic training from Lock Haven, and went directly from there to physical therapy school. I'm a licensed physical therapist as well. Worked my way through PT school as an athletic trainer. After PT school, I accepted a job in an outpatient clinic in the Charlotte, North Carolina area, treating a wide variety of patients in a typical PT clinic. Realized that really my passion was with young, healthy athletes. And so a position opened up at Lock Haven to come back and teach and practice clinically, working with their student athletes. And I jumped at the opportunity, and that was 22 years ago. My role has changed a little bit over the years. Now, primary responsibility is directing the graduate program in athletic training. So it's good to see all of you. I'm glad you're here. Our goal tonight is to just really share about the profession of athletic training, get you excited about it. I know it's a field that is really growing quickly. There's a bunch of new opportunities for athletic trainers out there. I think the public perception is a lot that athletic trainers are standing at a sideline for a football game or a soccer match. And that's really changed. And it's really changed a lot in the last 5 years even. There's a really quick expansion. So we're going to talk about the profession of athletic training, and then specifically talk about our graduate program in athletic training at Lock Haven. The job market is really strong. We're going to talk about that. We're going to talk about our curriculum, how it's set up, your clinical rotations, what kind of patients you might be treating. And at the end, a little bit, we'll talk about the admissions process. And if any of you are college seniors and you're thinking about applying, we can end the presentation and do a little bit more informal chat about how you actually go through the application process. The athletic training program is an in-person program. You will be housed at the Lock Haven campus. We've been doing athletic training education at Lock Haven for 50 years. And so it's one of the oldest athletic training programs in the state and in the Mid-Atlantic region. We really are proud of our history. We have athletic training alumni working in pretty much every practice setting all across the country. If you say you graduated from Lock Haven's athletic training program, you'll have a really good reputation as far as your skill set moving forward. A little bit about our program, just as a snapshot. It is a 60-credit graduate program. That's pretty consistent with all other graduate athletic training programs. Athletic training forever was a bachelor's degree. The accrediting body for athletic training transitioned it to a master's degree. And so now at this point, pretty much every program has transitioned to a master's. So ours is a 60-credit master's degree. 45 credits of that is coursework and 15 credits is clinical rotation, similar to pretty much every other healthcare field where you do some classwork, a lot of lab type activity, and then clinical rotations. We are accredited by the CATE, which is the accrediting body for athletic training education. Interestingly, several of the faculty in our program are pretty heavily involved with the CATE by doing volunteer work and service work. That really helps kind of keep our program contemporary and kind of cutting edge, keeping up with all the accreditation standards and those kind of things. We have a group of faculty that includes, we have a pharmacist that teaches in our program, a health educator, Dr. Allison, I myself am a physical therapist. We have 5 core athletic training faculty who teach in the program, and then an exercise physiologist. So you're going to learn from a really wide spectrum. And that's one thing that makes our program unique and different from other programs, is that you're learning from a variety of healthcare providers. It's not just a group of 2 or 3. There are 5 of us core athletic training faculty who all have a little bit different background. You know, we have one faculty member that's strong in sports psychology. We have another one that's really strong in evaluating and managing someone with a concussion. So really, we each teach to our expertise and our background, and that really, I think, strengthens our program. We have 100% employment rate. But actually, last year, the class of 2022, most of them had multiple job offers before they even graduated. The job market, like I said, is really, really hot right now. There's been a little dip in the number of athletic trainers graduating from programs, a small little dip, but there's been a real expansion in the number of jobs out there. And we'll talk a little bit more about career opportunities later, but it's really the expansion of job opportunities that's really driving that employment rate. We can't graduate enough athletic trainers. You will, you will come to our program, you will be successful, and you will get a job, no questions asked. It's not really an option. I also chalk some of that up to our large number of alumni. Every year I have alumni reaching out to me and saying, hey, look, we're looking to hire 4 or 5 athletic trainers. Well, who do you have that's still looking for a job? Those kind of things. I had so many offers this summer. It was nuts. So there's lots of opportunity out there. Our program is innovative. I like to think that we're kind of cutting edge in some of the things we do. Um, we were one of the first programs in the country to require a full semester long internship, and now that's an accreditation standard. I mean, it went so well that they actually turned that into an accreditation standard. So now all programs have to do it. We do things like we hire professional actors to come in and act out injuries or illnesses. And so you as a student will have a chance to interact. It's called a standardized patient. They use them a lot in medical school. So we've adopted that type of technology. We use simulations, things that are really not used a whole lot in athletic training education. We do have some scholarships and graduate assistantships available. We always get those kind of questions during these virtual events. So we have scholarships that are specific to the athletic training program. Some that are specific for incoming first-year students. We have an alumni scholarship that's specifically targeted for incoming students. It usually ranges $1,000 to $2,000. We have a couple other scholarships within the athletic training program, and then there are graduate assistant opportunities. So a graduate assistantship, just so you understand, that is typically depending on how many hours you're working for the university, you'll get some of your credits covered. So let's say you get a 3-credit graduate assistant. That would mean you wouldn't have to pay for 3 credits of coursework. In exchange, you work for the university. And on top of that, you get a small little stipend, right? So you get paid an hourly rate, and then you also have a tuition waiver for however many credits. So we've had some of our athletic training students do graduate assistantships on campus, and that's certainly an opportunity to help defray the cost. You're not doing athletic training work, you're doing other work for the university, maybe in our student rec center or across campus. Actually, we're trying to hire one in our own department next year, 1 or 2. So there's opportunities for that to help defray some of the cost.
And that makes it even more of a more rich investment in your future career too, knowing that you're not going to have to incur a ton of extra debt in order to complete this degree, which, oh, by the way, has a 100% placement rate. And we'll talk a lot more about that later. But I think scholarships and the graduate assistantships is an important thing to keep in mind as you're looking at graduate programs.
For sure, for sure. It's not, graduate school is not a inexpensive endeavor, right? And that's one of the things that, if I had kids that were looking at graduate school, that's one of the things that I would, and that's what I tell my students all the time. My undergraduate student is how much is it going to cost and how are you going to pay for it?
Yep.
It's important that you get healthcare is a graduate degree at this point, pretty much every healthcare field. So just making sure you're considering cost, and being a state university, we're affordable as is, and you throw in a scholarship or a graduate assistantship on top of that, and it definitely is affordable. We also have a number of our students that work. There's opportunities to work in town, either at a restaurant, or we've had students work at like Lowe's or Walmart or any of those kind of places. They're always looking to hire. And so there's some flexibility there that you can work. It requires really good time management skills, but you certainly can do that. I sometimes get a question about if you have a year, if you're an athlete. Sometimes we have athletic training students who are an athlete and you have maybe a year of eligibility left. You can participate as an athlete during the first year of the graduate program. And so we've had a number of students do that over the years. Their first year in the graduate program, you can participate as an NCAA athlete. And that's a pretty good combination. You have a really good understanding of what it takes to be an athlete, and from the kind of patient side, and then from the provider side as well. So we do provide that opportunity, and not all athletic training programs allow that just because of the rigor. But we find it's a benefit for both us and for the student. So here's our curriculum on the academic side. It's, like I said, it's 2 years, 5 semesters. We do have one class in the summer of year 1, which is a fundamentals and introductory level class. We have some, how to communicate with patients, how to communicate with a diverse group of patients. There's some really advanced first aid skills in there. There are taping and wrapping and padding, really kind of introductory basic athletic training skills are in that summer class. If any of you are seniors and you're looking to start the grad program next summer, that class usually runs what we consider second summer session, which is the last week in June and the whole month of July. It's 5 weeks long. Typically meets Monday to Thursday. It's team taught. There are 4 of us who teach that class. Again, all kind of to our areas of expertise. It's summer, so it's a little more laid back. It's a little informal. It's a good introduction to our program. And then in the fall, we really hit the ground running. So our whole first year is primarily musculoskeletal. And if that's what you're interested in, if you're interested in orthopedics, if you're looking to work in that kind of practice, that's what our whole first year is. So we have functional anatomy, eval, and interventions. One, that's the lower extremity. So we're in the functional anatomy class is our gross anatomy, our cadaver anatomy dissection, and we combine that with the biomechanics kinesiology. So it's, what are the forces on the foot while you're running, and how might that lead to an overuse injury if you have really flat feet or something like that. So the anatomy, the eval, so then we're evaluating that injury, and then rehab and intervention. So it's kind of a block sequence in that you're in class every day, 9 to 1-ish, and learning. And again, it's all lower extremity that first semester. We also have a evidence-based medicine class, which is a class I teach, which is a research class, learning how to apply the evidence we might find in the literature to your athletic training practice. You have a clinical rotation that first semester. We'll talk about those in a minute. So the first semester, it's all learning how to evaluate, learning the anatomy, and then how to evaluate and treat lower extremity musculoskeletal injuries. And it's really from that healthy athlete kind of population. Then the spring, it's the same thing, except it's upper extremity and spine. So again, shoulder, elbow, wrist, hand, someone with a spine injury. We also have a general medical conditions class that semester, which is now you have a patient that comes in that has the sniffles. How are you going to evaluate them? Do they need a referral? Maybe you have an athlete on your team that has diabetes and they're struggling to maintain their blood sugar. All the things that we see on a daily basis that's outside of the musculoskeletal realm kind of falls in that general medical conditions. Wrestlers are notorious for skin disease. Recognizing what kind of skin disease is it? Does it need referred? Do you have to cover it? Are they allowed to compete or not compete? That's all the kind of stuff that's in that gen med class. So that's all year 1, somewhere between 15, 16 credits each semester. Again, you're in a cohort. The only students that are in these classes are the other graduate athletic training students. We're expecting a cohort of close to 20 next year, right, Tom? That's our target.
Without question.
Without question, we're going to hit 20 next year. So you'll be in a class of 20, and it really creates this small, close-knit family type atmosphere. We have, again, 5 faculty members, 20 students. That's a pretty good ratio of faculty to students. And we develop really good relationships with our students, which helps them develop. We serve as mentors, help them find their first job, all those kind of things. And we keep in touch with them as when they're alumni. You don't have any classes summer between year 1 and year 2. You have the option of maybe taking the pharmacology class. It is offered in the summer. So some students choose to do that to lighten their load in the fall, but you certainly don't have to. Fall year 2 is our healthcare administration class. You learn about budgeting and insurance, designing an athletic training facility, all the laws that pertain to athletic training, liability, all those kind of things. Pharmacology is just that. There's a class that's taught by the pharmacist. It really kind of connects to the gen med class. So what kind of medications might our patients be taking and why would they be used and how long do they stay in the system, all those kind of things. Applied sport and exercise science is taught by an exercise physiologist. This is a class that talks about fitness testing, kind of all the performance enhancement side of athletic training. Sports science is the technical term that we're using now. A lot of high level soccer teams are wearing GPS tracker vests, and how do we interpret that data and what do you use with it? Body composition. There's a little bit of sports nutrition in that class, talking to your athletes about what they should be eating and when. Psychological aspects of injury and illness is really, it's kind of divided in half. About half of that class is talking to our patients that might have mental health issues. And so, again, it's talking to them, coming up with a diagnosis or how to refer, who do you send them to? So that's about half of that class. The other half is really the psychological aspects of injury. So if you're an athlete and you have a serious knee injury and you're out for 6 months or 9 months and you suddenly can't participate and you're not hanging out with your teammates, you go through a psychological response. So it's talking about that and how as an athletic trainer, we can help that patient through that process. And then the final semester, as far as coursework goes, in the spring is a current issues class. And it's really just that. I mean, it's just a semester long. That class is web-based. I'll explain why in just a second. But that class is web-based, and really it's pretty much current issues in athletic training. It's kind of the hot topics, whatever that might be. I know last year they spent a lot of time talking about the labor shortage and what's causing the labor shortage and all those kind of things. You do have a clinical rotation. I think I'll actually talk about clinical rotations from this slide. Each semester you'll be working with an athletic trainer or a physician who'll be your preceptor, the person that you work under essentially. The first year, our clinical plan is for you to spend most of your time in what we call the traditional setting. So you're going to be with an athletic trainer at either a college or a high school, either on our campus, in our local community, at a high school, at some of the, we have affiliation agreements with Lycoming College and Penn College and Williamsport. So that's the first year. You're there maybe about 20 hours a week. You're in class during the day. You go in your clinical rotation in the afternoon, really practicing, developing those skills you're learning in the classroom. Students love the time they spend on the clinical rotation. It really kind of reinforces what they're learning. That's time really well spent. So that's the whole first year. So fall and spring, again, working with one of our preceptor athletic trainers. Fall of year two, that semester we mix it up a little bit. You spend some time in our on-campus rehab center. We have on our campus a rehab center where we treat athletes who have had surgery, or maybe they have a long-term injury. They've dislocated their shoulder or something, and they're going to be out for the season. They need long-term rehab. They come to the rehab center. So about 8 weeks, you're going to spend every day in the rehab center, evaluating those patients, doing a lot of exercises with them, getting ready back. Right now, so I work in that rehab center 2 days a week, and we're treating right now a ton of patients who have had ACL reconstruction. We've had a couple wrestlers with pretty significant knee injuries, a wide variety of long-term rehab needs. So if that's kind of your jam, if you really like rehab and that's where you kind of see yourself working, that'll be a rotation you like. And again, you're typically in there for about 8 weeks doing that clinical rotation. And then for the rest of the semester, we rotate you through a bunch of different practice settings. So you'll spend some time with a physician in a local family practice clinic. So you're seeing everything from someone with a earache to an older person that might be having shoulder or knee pain. It really exposes you to more than just the 18 to 22-year-old college athlete. It opens your eyes to the other type of patients that are out there. We spend a rotation with a local orthopedic group. So that orthopedic group hires several athletic trainers to work in their office. So you'll spend some time working with those orthopedic surgeons. You'll actually get in and watch surgery for a day or two. So that's that year two fall. It's just the rotation through a couple different practices. And there's one more. We have a local chiropractor in town in Lock Haven that does a lot of performance enhancement and functional rehab. He does a really nice job of rehab with his patients. And so that's just from a different perspective. We have you spend a week there with him. That's fall of year two. And then year two spring is really kind of our pride and joy. That's the semester long internship where you can go pretty much wherever you want across the country for a whole semester. It is aligned with your career goals. We start talking to you about your internship almost on day one in the program. Like, okay, where do you see yourself working and how can we line up that internship with those career goals? Anything from you want to be a high school athletic trainer in a small little high school in rural Pennsylvania, we can do that. If you want to work with Division I athletics and you want to see that kind of limelight, we have those opportunities. Last spring, we had someone with the University of Tennessee with their softball team. We had someone with Major League Soccer just recently. So it's really meant to align with your career goals, and it often will lead to your first position. That's really, the goal of that rotation is for you to really finalize your skill development, but it's also to kind of get you ready for that first job, make those connections and what you need to get. That's one of the reasons why we have 100% employment rate is because of that semester long internship. If you're looking at other athletic training programs, you might see one of those that's maybe 6 or 8 weeks long. We really think it's important that you're there for a full 15 weeks. So you're there for the entire spring semester. If you want to go out and see the country, this is a chance to do it. And I talk to my students all the time. It's one semester. You can find an aunt that lives on the beach in Hilton Head, South Carolina, and we'll find you a rotation down there, right? That's what I did when I was in grad school. It was the best move of my life. I spent a summer on Hilton Head on an apartment across from the beach, and it was fantastic. So again, if you're interested and willing to see the other parts of the country, that's an opportunity for you for that last semester. So that's our curriculum. Again, 60 credits, 15 of those being clinical rotations. And again, if you have questions along the way, I guess put them in chat, right, Tom? Or I don't know if you can unmute yourself or not, but at least put them in chat and we'll follow up at the end.
Yep, chat, Q&A. I'll certainly see them and I'll get them to
Okay,
Dr.
great. So here's some of the sites that we've used very recently within the last 2 years. Students are always asking, like, what are my opportunities for that last internship? So the Rothman Institute is kind of the premier orthopedic group in the Philadelphia area. They have a bunch of different orthopedic group, and they are doing a lot of work with concussions now too. So it's really orthopedics and concussion. They are really the premier orthopedic sports medicine provider in the Philadelphia area. So last spring, we had a student intern with the athletic trainers there in that practice. It was really awesome. And we'll talk about that student in a minute, but he accepted his job in an orthopedic practice. He's working with a physician. Sporting Kansas City is a Major League Soccer team. And we had a student who really wants to work Major League Soccer. And so she did her internship with the Sporting Kansas City. Like I said, University of Tennessee and University of Michigan. The individual that was at University of Michigan really was interested in runners and gait and how, runners often have shin pain and leg pain. So he did a lot of work with that group when he was at Michigan. Clemson, Penn State. We had a student that did their internship with Penn State football last spring. That was our first student that was there. It went really well. They actually invited one of our students to come back for football this fall. So he was only able to go for preseason, but he was with the Penn State football team during their preseason camp in August and had a really good experience. And then a ton of high school opportunities. And, that opportunity for athletic trainers is still there. That hasn't changed. College and high school jobs are still there. And that's really where the majority of our alumni go. Probably 65% of our alumni are at the college or high school setting. And so there's numerous opportunities, everything from really big high schools to small little rural high schools are in Pennsylvania or New York or kind of wherever you want to go.
And Eric, as we talk about these internships, how are students identifying these internships? Is there, what's the process of them finding them?
Yeah, really good question. So we have a list of where our students have gone in the past, and that's kind of our preferred list. And it's really growing. There might be 100 sites on that list or more. So you can just kind of flip through that and see if there are any of those that kind of pique an interest. But if you come to us and say, you know what, I really want to go to this area, or I really want to be in this setting, we have one of the faculty members, Dr. Jody Russell. She is the clinical coordinator for the program, and she does all the clinical placements. So you simply go to Dr. Russell and say to her, I'm either interested in this geographic location, or I specifically want to go to this college or university. And we work our tail off to get you that spot. we, in the fall of year one, we do a activity where we have the students come up with their kind of top 3 list, and we just work through that list until we find a site. There's a process. I mean, there's a contract that has to be established. There's a lot of kind of things that have to happen on the back end. But we're willing, and a lot of these that are on this list are new. Like, we've just added these in the last couple of years. And that's all because students have wanted to go there, and students have kind of pushed us to add to our internship sites.
See, and I think the important part for students in the audience is like, they're going to work with you to identify that. This is not like, hey, here's the paperwork, you've got to do this internship. Let me know where you're going to do it. It's like, no, we're going to help you identify the right place. We're going to help you get the placement. This is where the reputation of the program is also very important too, because you have the benefit of the Lock Haven Athletic Training Program behind you. And that kind of basically, whether you know it or not, they've kind of already made a decision about whether or not they're going to accept an intern based on the success of the program and the previous students. So that's a really important thing to keep in mind. For
sure. And a perfect example of that is Penn State, right? We sent a student there last spring, and they were willing to, or they invited a student to come back in the fall for preseason. And if it would have worked out, he would have been able to be there all fall during the whole football season. We struggled to do that with classes in the fall semester. So he was just there for the preseason camp, but that's a good example of that. And again, it's really up to the student and what the student's career goals are. And it's a lot of just sitting down and talking to our students. We have a really close relationship with our students. We really like to say it's almost like a family type relationship. You make a connection with one of your faculty members, and that person is your mentor and kind of guides you through this whole process. I want to talk about career opportunities. We've talked about this a little bit already. The job in the college university setting, I will tell you, it has changed some in the last 5 years. No longer are athletic trainers at the college university setting just sitting at soccer practice for 2 hours. I would say that at most college universities, that's like maybe 25% of their job. The majority of their day is spent doing treatments, doing rehabs, almost like a PT clinic would schedule appointments. I mean, that's where most colleges, universities are with athletic training services. So, the athlete schedules an appointment at 10 o'clock, and they come in and they do rehab, they do treatment, all those kind of things. And then they go out to practice later in the afternoon. So that job for most college athletic trainers has changed a little bit. It's a lot less kind of on the field, sideline type stuff. That opportunity is still there, but it's more of the treatment, interventions, those kind of things. Now, on the high school setting, I will say that most of your time is spent on the sideline, in the athletic training clinic, in the athletic training room before games and practices, those kind of things. I mean, most school district, there's some type of sporting event happening almost every night of the week. With soccer, football, volleyball, whatever, there's something going on that the athletic trainer is there for. We'll talk a little bit more about work-life balance. But just know that if you're in a high school setting and that's the job that you want, you're probably going to be working almost like a later shift. You might go in at 12 o'clock or 1 o'clock, and you might work till 8 o'clock. It's really changed in the number of hours you're working. It's just a little bit later shift if you're at the high school. And that's just kind of the nature of the job and when high school athletics take place. And if you really like the Friday night lights kind of thing, if that's what you want, then I think the high school athletic training job is a pretty sweet deal. Professional sports opportunities, this is kind of like the traditional where you see athletic trainers with professional sports. That we always have students that come in and say, I want to work NFL or I want to work MLB. That's great. We'll help you do your best to try and get there. Just know that those job opportunities are pretty slim, and you've got to put the grind in order to get there. We'll help you with that. We'll do what we can. We have alumni that are in each of those practice settings, soccer, football, baseball, hockey. We have alumni in each of those. It's just, you got to be willing to put the time in and the grind to get there. And then in the emergent settings, these are kind of new and kind of growing areas. And this is what I find this really exciting about athletic training. And this is what gets me really kind of jazzed up is orthopedic offices. I just talked to someone yesterday, had an email exchange. They work in a physician office in Vermont, takes the patient back to the room, does a preliminary exam with them, relays those findings to the physician. The physician comes in, does a quick exam. They talk together about the case. They decide, do they need an MRI or do they need to go to rehab, or what's kind of the plan? Do they need an injection? So they're working hand in hand with a physician. This is really a growth area, and they're awesome jobs. They usually pay really well. They usually have really good benefits. They're usually a 9 to 5 kind of job. Really kind of exciting growth opportunity for athletic trainers. A lot of those physician practices in the past were hiring maybe nurses or nurse assistants to take the patient back, and the athletic trainer has really kind of proven their worth in that setting. There are even some states, and not our Practice Act doesn't allow it in Pennsylvania, but in some states, the athletic trainer is actually assisting in the operating room. I know some people that are in the West, in the Rocky Mountain area, that they're assisting in the operating room. So they're, helping the surgeon all the way from, initial exam all the way through the surgery. Pretty cool stuff. Rehab clinics, traditional PT clinics in some areas, they're hiring athletic trainers. There's not a ton of this, especially in central Pennsylvania, but it really depends on where you're located geographically. The military is hiring a ton of athletic trainers. Each of the military bases has numerous athletic trainers, and you can either do it as a military personnel, or you can do it as a civilian contractor. I would say most of them are probably civilian contractors. I just read an article recently that I think the Marines are looking to hire 60 athletic trainers this year. And so it used to be the athletic trainers was embedded with the special forces, which how cool is that? That you'd be embedded with the special forces, where the special forces go, the athletic trainer went. And now they're really stationed at the base, doing exactly what an athletic trainer does, except the military personnel. And in performing arts, this is always one where we have a little bit of interest. This is for your patient in this case might be a dancer, or someone that's in the orchestra. The dance is probably the big one, Cirque du Soleil, those kind of things, and major metropolitan areas, those big performing arts places, they are hiring athletic trainers. There's a few, not a lot, but there's a few marching bands across the country that have their own athletic trainer. The really high performing marching bands have their own athletic trainer, which is pretty cool to think about. But the job market is really, really good right now. You will write your own ticket as an athletic trainer. Things like sign-on bonuses, up to $10,000 sign-on bonus, retention bonus. So if you stay with the company or the organization for a year, they'll give you a bonus. Better work-life balance, meaning less hours worked for better pay, better benefits, all those kind of things. Job outlook, like I said, it's really expected to continue to grow even more. And like I said, there's lots of opportunities. We have a large number of alumni that say, you know what, I'm going to give the Division I athletics thing for a run while I'm young, and I maybe don't have a family, I don't have kids for the first 5 or 10 years. That's what I'm going to do. And then, you get 10 years of experience, and you say, I've done that game. Now I'm going to work in the doctor's office. And then you're working more of a 9 to 5. And so there's lots of different opportunities, and moving around is pretty common. If you're not happy with the job, make yourself happy, find something else. The salary, most of our class of 2022 starting salary was in the 50,000 range. That's a pretty decent starting salary. That's kind of where we are as a profession right now, with the opportunity to quickly grow up from that. I will tell you that's kind of a base salary. A lot of places now are hiring, are paying shift differential, which is essentially if you're working nights or weekends, you're going to actually make more. That comes out of a hospital model. So like if you're a nurse and you work the night shift, you get paid more. The same thing as applying for athletic training. So a lot, especially high school jobs where they're struggling to find enough athletic trainers, they're starting to do things like that, where if you work past 6 o'clock at night, you're going to get paid extra for every hour. And most high school athletic trainers work past 6 o'clock at night. So every night you're essentially getting overtime. It quickly adds to your salary. So there's lots of unique opportunities right now, and the job market is hot.
Well, and I think one of the things I was just so surprised to hear is that basically the variety of different careers that you can enter with this program. And I think that's probably just speaks to the growing nature of the field of sports medicine, which is just, it's exploding, and it's creating a demand for professionals like this that frankly, we just can't roll them off the assembly line fast enough. So it's a good time to be an athletic trainer. For sure. I wanted to highlight 3 of our alumni from this past class, the class that just graduated in the spring of 22. The first,
did his internship. He actually split his internship between two different sites. He was with Lehigh University, a Division I university down in the Allentown, Bethlehem area. That's where he's from originally. And he did the second half of his internship at Rothman Institute, which is that big orthopedic group in the Philadelphia area. And then he was offered and accepted a job really early, probably April, graduated in May with Premier Orthopedics, which is an orthopedic group in the Philadelphia area, Brandywine area. And really strong student, came in, was really involved with some of the clubs and organizations on campus, won several of our scholarships along the way. Really, he's going to be really good and is a good representative for us in that kind of physician practice setting. The second student, she's the one that did her internship with Penn State football last spring. She's our first student that we ever sent there. She knocked their socks off. They emailed us all the time and talked about how good she was doing, how well she was doing. They were super impressed with her and her performance. She actually interned the summer before with Sporting Kansas City, which is the Major League Soccer team, and they offered her a position. And so she's out in Kansas City working with MLS soccer right out of grad school, treating MLS soccer athletes on a daily basis. And she played soccer in college. And so she's a huge soccer fan. So she's super excited about that. I just had a little text exchange with her yesterday. She's doing great. She's loving her job, loving life. And then the third one is kind of the traditional Lock Haven athletic training story. She did her undergrad at Lock Haven. She's from South Central Pennsylvania, did her internship at Shippensburg. We have a number of alumni that work as athletic trainers at Shippensburg. So she went and spent time with them, and she accepted her first job as a high school athletic trainer, employed through UPMC, which is a big employer of athletic trainers in Central Pennsylvania. And that's the kind of the opportunities that are out there. I mean, this slide is just to highlight kind of the opportunities and the experiences that you'll get and how they'll help you get that first job. Hopefully we'll add your name to this list in a couple of years. To talk a little bit about the application and admission process, and if this is something, if you're a senior and if we have follow-up questions about this, we should talk so that we can get the application rolling. We do, if you're an undergraduate degree, it doesn't matter what your undergraduate degree is in. You might have an undergraduate degree in exercise science or health science or even psychology or biology. It doesn't matter as long as you have a 3.0 GPA and B, the necessary coursework, right? And you can find the necessary courses on our website. It's things like anatomy and physiology, a biology course, a chemistry course, a physics course, psych, stats, those kind of things. You can find those on the Lock Haven Athletic Training website. But as long as you have an undergraduate degree, a 3.0, and those necessary courses, you're eligible for admission. We don't require the GREs. We stepped away from the GREs during the COVID pandemic, and that was a good move on our part. I'm not sure they were a real predictor of success in graduate school. So we don't require the GREs. We do want you to have 3 letters of recommendation. So that might be from faculty members, maybe employers, typical grad school letters of recommendation. We want you to write a statement of your professional goals and what you want to be and how you can get there. And then finally, if once we review your application, you'll have an interview with the faculty. So athletic training, like most other healthcare graduate programs, we use a centralized application system. It's called ATCAS. That's ATCAS. If you Google that, you'll come across that. And that's simply where you create an account and you enter your information. You select Lock Haven University from the universities you want to apply to, and it sends the application to us. It's a common application, essentially, is what it is. But again, if you have questions about that, it's not user-friendly. I hate to admit it, but it's not super user-friendly. So if you're working through that application and you have questions, feel free to just email me. My contact information is on the final slide. Just reach out. Happy to either sit down with you if you're on the Lock Haven campus, or we can set up a Zoom and I can talk you through that HECAS application. We have set kind of a soft deadline of November 1. We do hope to receive a number of applications by November 1st. That allows us to schedule interviews before Christmas, the semester break, so that we'll have then our first round of interviews in December, late November, early December. So if you get your application in by November 1, we'll guarantee you an interview in late November. We'll still definitely accept applications after that. We actually accept applications pretty much up through May. But that first kind of round, that first wave of applications, we hope to have those in by November 1st. So at that point, you have to have your grades entered into ATCAS. You have to have your 3 letters of recommendation, and you have to have a statement of professional goals. Not on this slide, and Tom, we need to fix this, is you do need to have some observation hours under an athletic trainer. You have to have 75 hours of observation. You don't have to have those complete at time of application. You can complete those over winter, over into the spring, that's fine, as long as they're complete by the time you start the graduate program in the summer. So you can still submit your application now, even if you don't have your observation hours done. The only things that we really need at time of application are the letters of recommendation, your class grade, your transcript, and your statement of professional goals. We can get the other things throughout the spring. And again, that application portal is ATCAS. If you just Google that, you'll be able to find it. I know some of the people on the call tonight have already started their application.
That's great. Well, does anybody have any questions? Any questions at all? I know we've got Dr. Lippincott here, so if there's anything you want to know more about, now's a good time to be able to fire off some questions here. Good news is everyone's getting a $35 scholarship in the form of an application fee waiver. So when you go to, actually, you know what, for ATCAS, actually, I don't think there is an application fee. Right. Okay. Right. So that was already built into
the that one because it's an external.
Right. Yeah.
He's right. Telling you not truth already.
Yes. Right. Exactly. Listen to Dr. Lippincott when in doubt. Yeah.
Are any questions tonight?
Yeah. Let's see here. Nothing in the Q&A, nothing in the chat. And again, Dr. Lippincott had mentioned that he would be hanging out afterwards too, in the event that anyone has some, basically any type of application related questions. What do you think about the program? And if not, that's okay.
Yeah, totally okay. And if you want to stay on and have a little informal chat afterwards, we're happy to do that too. If you want to talk about the application process or ATCAS or anything like that, happy to chat in a more informal setting.
And again, and I'm sure, Dr. Lippincott would be, if you wanted to schedule a follow-up meeting, that'd be fine too. We could certainly facilitate that as well.
For sure.
Well, I'll assume probably not then. And that's okay. So if there's anything that we can do to help, please don't hesitate to contact Dr. Lippincott or myself. Let me put my contact information in the chat here. You can call me, you can email me, whatever's easiest for you, and I'm certainly happy to help. But again, thank you so much, everybody. Really appreciate your time tonight. And we definitely look forward to hearing from everybody here in the future. And we invite all of you to apply.
Yes,
we wouldn't be doing this if we didn't think that this was honestly a good investment in your future career. I think the 100% placement rate speaks to that. I think the variability in your career fields, I think basically the growing demand in sports medicine and athletic training, those are all things like you're hopping on this train at the right time. So this, like I said, it's a good time to be an athletic trainer. So again, we look forward to hearing from everybody in the future, and I hope everybody has a great night.